Welcome to Frederick at its best. I'm Frederick County Executive Jan Gardner. October is Breast Cancer Awareness Month, and we're here to raise awareness and to talk a little bit about breast cancer. Breast cancer and other cancers can affect everyone, regardless of age, race, or gender. Today, we're joined together to raise awareness of breast cancer and to focus on the importance of early detection. About 1 in 8 women in the United States, about 12% of all women, will develop invasive breast cancer at some time during their lifetime. Thanks to the American Cancer Society and dramatic improvements in cancer research, millions of women are surviving breast cancer. There are more than 2.8 million women in the United States who are breast cancer survivors, and that's good news. Early diagnosis and better treatments have improved the survival rate. Survival rates have increased since 1990. That's why it's so important for women to do self-exams and to have their mammograms. Women whose mother, sister, or daughter have been diagnosed with breast cancer are twice as likely to develop the disease. But more than 85% of women who develop breast cancer have no family history. That means most women who get breast cancer do not have a close relative with the disease. It is crucial that all women conduct self-exams and that women over the age of 40 should get a mammogram every year. Men can also develop invasive breast cancer, so everyone should see a doctor if they notice a suspicious lump in their breast. There is no sure way to prevent breast cancer. Some risk factors, such as family history, cannot be changed. There are lifestyle changes, however, that can lower your risk, according to the Mayo Clinic. Breast cancer awareness and breast cancer prevention starts with healthy habits. One of the most important habits is regular self-examinations and mammograms. Insurance is required to cover all mammograms. There is something we can all do in this battle against breast cancer, and Breast Cancer Awareness Month is a good time to learn about how to prevent and detect cancer and to learn about resources available in our community. I'd like to take a moment to read a proclamation. Whereas breast cancer is the most commonly diagnosed cancer and the second leading cause of cancer deaths in American women, about 1 in 8 women will develop breast cancer during their lifetime. According to the American Cancer Society, in 2017, an estimated 252,000 women nationwide will be diagnosed with breast cancer. Nearly 40,000 women and 400 men will die from breast cancer. Maryland has the 6th highest rate of death from breast cancer. The Society estimates that 5,250 women in Maryland will be diagnosed with breast cancer this year, and 820 will die from the disease. Whereas every woman is at risk for breast cancer, even if she has no family history or other risk factors for the disease. And whereas screening and early detection is essential to the well-being and health of Maryland women, through the Frederick County Health Department Breast and Cervical Cancer Screening Program, 384 women received clinical breast exams, screenings, and mammograms last year. And whereas research shows that screening mammograms can help reduce the number of deaths from breast cancer among women, however, only 56% of Maryland women report receiving a clinical breast exam and a mammogram within the past year. Whereas Frederick County is pleased to join with the Department of Health and Mental Hygiene to encourage women to learn about their risks for breast cancer, talk to their health care providers about recommended breast cancer screenings, and to be screened with clinical breast exams and mammograms as appropriate. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim October 2017 as Breast Cancer Awareness Month in Frederick County and commend this observance to all of our citizens. Now, you can see that I'm joined by a large group of people here today who all play varying roles regarding breast cancer and breast cancer awareness, research, or raising funding to help fight for the cure. And so there are many people are wearing these shirts, which are being sold by our career firefighters, and they're going to speak to that today as well. So I'm going to start off by passing the microphone to a few people to speak, and I'm going to start with you.
Hello, my name is Avnisha. I'm Coordinator of Outreach and Education for Breast and Cervical Cancer Program at Frederick County Health Department. I would like to thank our County Executive Jen Gardner for having us all here and also recognizing October as Breast Cancer Awareness Month. Our program provides clinical breast exam, mammogram, and pap test to all the eligible women of Frederick County who does not have insurance or who has limited insurance. So if you are a woman who is 40 years and older and is in need of a mammogram, please give us a call at 301-600-3362. Please always remember, prevention is better than cure, and always take action against breast cancer. Thank you.
Hi, my name is Kathy Duncan, and I'm the co-chair of the Frederick chapter of the National Ovarian Cancer Coalition. I'm a 5-year ovarian cancer survivor, and my mother also had breast cancer. It's very important that all women know the signs and the symptoms of breast cancer. We all can benefit from knowing the risks of both the symptoms of breast cancer and ovarian cancer. We should also know our family history, the health history of those in our family, because with that knowledge comes power.
My name is Miriam Dobson. I'm the Director of Community Health Services at the Frederick County Health Department and also the daughter of a breast cancer survivor. And I just want to commend all of the efforts taking place here in Frederick County to detect and to treat and hopefully prevent breast cancer.
Okay, do you want to pass it down to Frank? You can introduce yourselves if you want. Frank, do you want to say a few words?
Sure. Hi, I'm Frank Blanchard. I'm with the Frederick National Laboratory for Cancer Research, which is operated by Leidos Biomed. And we have 2,100 talented and dedicated individuals that are working to better understand what goes wrong in the human body that results in breast cancer and to come up with more effective, targeted treatments for the disease. So we're at work day by day on this really tough problem.
Okay, we'll turn it to our career firefighters here.
Hi, I'm Chris Mutchler. I'm firefighter with Frederick County Division Fire and Rescue. 2012, we started the Pink T-shirt program where we raised money for the Hurwitz Fund. Since we began in 2012, we've raised over $100,000. And I'd like to thank Chief Owens and the division and Jan Gardner and the county government and all the county employees, because if it wasn't for them, we would never have raised that much money.
All right, turn to you, Jeff.
Okay. I'm representing the fund today. I'm Jeff Hurwitz. I'm sorry my wife Patty, who's the driving force behind the fund, could not make it. She had a prior commitment, and if she was here, she would tell these firefighters how proud she is of all the work they've done to raise awareness and money for our fund, which all the money that we raise stays right here in Frederick County at FMH, where all the equipment, we get the latest equipment, and everything stays here, so people like my wife, when she had breast cancer, do not have to go down the road for great treatment. Now they can have that great treatment right here, and we're just so glad of all the work that the firefighters and the recognition that you're giving the fund also. We appreciate that too, Jan. Thank you.
Thank you. Does anybody else want to say anything? Okay. We have a lot of firefighters with us today, as well as county employees who do a great job of helping to support what the firefighters do by buying the T-shirts that come out every year. So we're very proud of our career firefighters and our county employees for their generosity and efforts to raise funding to fight breast cancer in our community. And of course, we're very appreciative of Jeff and Patty Hurwitz for their efforts over many years to raise lots of money to support breast cancer treatment in Frederick County. And I know that a number of our municipalities and many other organizations in our community are also out there raising awareness and raising money so that we find a cure for breast cancer. So I want to thank all of you very much for being here today for this. It really is a community effort, and this really is a sign of how Frederick County is that special community because of the people who live here. We're very proud that we do cancer research in our community to also try to find the cure. And so Frederick County really is really part of the solution to this great challenge that we face as a community and as a country. So we do hope that we find a cure for breast cancer. There's certainly a lot to be considered, a lot to be aware of. We hope that all the women who are watching this will make sure that they get their annual screenings and mammograms. And we hope that today's ceremony has raised awareness for people in our community so that we can prevent and detect breast cancer early. Thank you for joining us for Frederick at its Best.